Noon on my clock, so I think we're going to go ahead and get the web discussion started. I see folks are still popping in, and that's fine, but we'll go ahead and get the ball rolling so we can have plenty of time for our discussion today. I am delighted to be helping to facilitate our what's really a part 2 webinar of a discussion we started back in February. So we're going to be talking today about delivering EI services in childcare settings, and we're going to get real. We heard from you all. Lots of folks gave us feedback at the end of the webinar in February where we started this discussion about delivering services in childcare settings. We also heard feedback after the webinar that folks really wanted to dig a little deeper and have opportunity to share strategies and talk about what it's like to provide services in childcare settings and the challenges that we face, and specifically how to overcome them. Like, what are other people doing to manage these challenges? Because if you provide early intervention for any amount of time, you're going to end up in a childcare setting, particularly a childcare center, and it's a really unique environment that challenges us to use our skills in a different way. So today we're really going to focus on childcare in center-based settings. We won't really specifically be talking about family childcare homes, because when we started the discussion back in February, we really focused on that center-based environment. So we're kind of going down that same path. However, we encourage you to think about the strategies that we'll all generate today and how you could adapt them in any type of childcare situation. So I am really delighted to have a panel today. So let me flip my slide. So in February, Cynthia Core, who's on our panel today, really led the discussion. And so we're happy to have Cynthia back. We have some other service providers as well, because we wanted to have the opportunity to share the expertise and facilitate the discussion from multiple points of view. So I'm going to have our panelists all introduce themselves. My name is Dana Childress. I forgot to say that at the beginning. I'm an early intervention professional development consultant with the Partnership for People with Disabilities at VCU, and I'll be sort of acting as the facilitator, kind of the host today. Cynthia, you want to introduce yourself?
Hi, I'm Cynthia Core. I'm a professor in the Department of Speech and Hearing Sciences at the George Washington University in Washington, D.C., and I'm also a speech-language pathologist and early intervention provider in Arlington County.
All right, thank you, Cynthia. Patty, will you introduce yourself, please?
Sure, Dana. I'm Patty Eichmiller. I'm an infant development specialist with the Infant and Toddler Connection up here in Alexandria, and this topic is kind of a passion of mine. I've presented on it a couple of times, and I love engaging in communications and just discussions about it. So I'm looking forward to today.
Great, thank you, Patty. And Andy, if you'll introduce yourself.
Hi, I'm Andy Englert. I'm an occupational therapist by trade. I have my own company. I contract down in the southeastern part of the state in the Crater District for early intervention services down there, and I also am a master coach.
Great, thank you, Andy. And it looks like some of your peeps have joined us. I see we have Crater District as some of our participants, so that's awesome. So I want to welcome our presenters and thank them for taking the time to walk through this with us and to share their expertise today. One of the roles of our presenters, though, today will be also to help discuss your expertise. What we're hoping is that this is a discussion that's more than just what the presenters share. We will be tapping into the collective expertise of everyone on the phone and on the web discussion with us, because we've got a lot to share, and so we're hoping that this is sort of a reciprocal, kind of a mutual sharing, because you're going to see scenarios today that I'm sure you'll go, yep, been there, done that. So we invite you to use the chat today to share your experiences. I also wanted to recognize that our panel team is not complete. Sure, it would have been wonderful to have also had a physical therapist on with us. It would have been wonderful to have a service coordinator on with us, but I wasn't able to find folks that were able to block this time in their schedule, which is, just how it goes sometimes. So if you are in any of those roles, especially those of you who are service coordinators, please do add your perspective to the discussion, because we talked in February about how important the service coordinator's role is in coordinating services between early intervention and child care settings. So just sort of invite everybody to throw your hat in the ring and share what you do. So we're going to start out by, we just wanted to get oriented to where you are and what your experience with this topic is. So we wanted to find out if you participated in the February talks on Tuesday on this topic. So you're going to let us know by using your pointer tool. So look to the left of your slide and you'll see a vertical toolbar that has lots of little squares, little pictures in it. So the second box down should look like a little starburst. It might have a smiley face or a check mark. If you click on that second box down, yep, I see people getting the hang of it, and then move your cursor over to the screen, you can place your pointer in the yes or no clouds. And I see folks are starting to do that now. If you have any trouble with this, this task, you can certainly type it into chat too. But as you can see, if we all use our pointers, it gives us a nice visual. So let me check in and see if folks are still putting their pointers on. Looks like we have one or two. So far it looks like mostly we've got folks joining us today who did participate in the February Talks on Tuesday webinar. And so if you did, I hope this helps you kind of dig a little deeper and think about this topic a little more. If you didn't, you'll be fine too. Cynthia and I are going to give a quick, sort of a brief revisiting of the strategies we talked about last time, and then we'll spend most of our time today problem solving some challenges that we've all faced from our experiences in these settings. So whether you participated or not, we hope today you will leave with some really concrete strategies, maybe a few new ideas for your toolbox for the next time you find yourself in a child care setting. So next I'm going to turn it over to, I'm going to go through our objectives first. So our big picture objective is to work together with you to identify specific strategies that we hope you can use to overcome obstacles and feel confident delivering services in child care settings. So we're hoping today you'll learn, who doesn't like a new strategy or two? And we're going to do that by discussing specific real-world scenarios that are based on our experiences. The challenges will be quite apparent in those, I think, and then we'll brainstorm solutions and strategies for each of the scenarios. So now I'm going to turn it over to Cynthia to get us started thinking about what EI looks like in child care.
Okay, we all know that providing services in a child care setting is a little bit different than when we're in the family's home. And if you have some ideas about what a successful visit looks like in the child care setting, then go ahead and use the chat window on the upper right of your screen to type in some brief ideas about what you think a good visit would look like.
Yep, so again you're going to look in that lower left-hand corner, and that corner will have that white box, the little strip down there. You type that and you type your comments about what do you think it looks like when you're doing EI in child care settings. Yep, I see comments are starting to come in.
Corey found it. My box is in the upper right. Sorry about that. Corey says lots of communication. That's a great suggestion, and peer modeling, including the provider, right? This is one of the key issues, is that we're not working directly with the child, but with the provider to identify strategies that are going to work. And I see another participant is saying to work together with the provider. Corey mentions recognizing their expertise, right? At home, the parents are the experts on the child, but in the child care center, the child care providers are the expert on the child. Lots of coaching, an enthusiastic exclamation mark. Yes, and within the classroom routines, exactly. That we're working with the provider, we're using coaching to work within those classroom routines is a great way to sort of summarize what a successful visit would look like.
I like too, Cynthia, that somebody, I forgot the name, wrote in that there's kind of integration between the teacher and the caregivers, maybe the parents or whoever's taking care of that child outside of child care. So kind of some kind of connection between the two environments too.
There it is. Yep. That's great. Okay. So now that we have some ideas about what a successful visit might look like, we're going to move forward and talk about some strategies that we identified during our last session when we talked about getting started working in the child care setting. Some of the things that we identified that would make visits in a child care setting run more smoothly are getting everyone on the same page from the very beginning. So as one of our participants just said, integrating the home environment with the child care setting and the EI provider. And if we do that from the very beginning, before we walk into the child care setting, then things are going to run more smoothly. One way to do this might be writing the IFSP at the child care center. And of course, this is where the critical role of the service coordinator comes into play, because they can really help us manage both of these ideas or strategies. So if we write our IFSP at the child care center, then we might be able to identify difficulties that the child is having in that environment that aren't the same as any kinds of difficulties that the child is having at home. And it might help us identify either weaknesses or strengths of the child's abilities in that new environment. And the third piece is that we should be developing communication plans for teachers and parents to stay connected. And there are lots and lots of ways to do this, but making sure that for every visit, both parents and the child care providers at the child care center are able to communicate with the early intervention provider and stay connected to know what's happening in that setting. Okay.
Okay, so we also talked about some specific strategies for the classroom, and you guys have actually hit on some of those in your chat so far, which is great. We talked about how we can still set up great communication strategies and kind of do the IFSP, have all the ducks in a row, and then walk into the classroom, and it can still be a challenge. So just like Norfolk said on here, we want to make sure we're using our coaching strategies, our evidence-based practices to support the child care provider in practicing using intervention strategies with the child. So we talked about some specific ways to kind of facilitate that. We talked about asking for permission before the service provider does any modeling, and I think it's a good idea to ask for permission before you even broach a challenge. Something that you might see as a challenge might not be as regarded as a challenge by the teacher, and we know sometimes there's some sensitive topics, so we certainly want to be gentle and build that rapport. If the child care provider mentions a challenge or mentions something he or she's working on, we talked about asking what they've tried, asking if you can observe, could you show me how this works, or let me, I'd love to see what you're doing. So sort of taking advantage of that child care provider's expertise and taking the time to observe and get familiar with what's already happening in the classroom. We also talked about reflecting and providing feedback on any practice opportunities to help that child care provider think through what he or she's doing, how it's working, kind of to prepare that person to be able to use those strategies with the child when you're not there. And then certainly using some joint planning so that you come to kind of an agreement on what the child care provider is comfortable trying between visits, and you have that plan to follow up with on your next one. So I think on kind of our big picture, one of our key points last time was we felt the early intervention service provider goes in and can really be beneficial to help that child care provider see the child's potential. That, the reality is many child care providers don't have a lot of training to work with young children with developmental delays or disabilities. So you going into the classroom can be a great opportunity, kind of all around. We all, we get to learn from them and they get to learn from us, and hopefully we work together to build that child care provider's capacity so they really feel comfortable supporting that child throughout the week. So we did that last month. We dug into those strategies, but we still heard you. Okay, so I'm going to build good communication. I'm going to go in ready to use my coaching skills, but what do I do when this happens? And as you all know, you can walk into these environments and you never know what's coming at you. So you've got to be ready, think on your feet, and use your skills in a flexible manner. With that said, there are some common experiences that many of us have had as early interventionists. So we've tried to pull a couple of scenarios together for our discussion today to talk through. We know that we certainly aren't going to have this. There's lots more we could talk about, but we wanted to at least get us all thinking. So here's how these are going to work. I'm going to click the slide and a scenario will pop up. I'm going to read it in case we have anybody who's just listening by phone and is not on Blackboard with us. And then I'm going to open it up to you guys on the phone, and I'm going to ask you to type into chat, what would you do, how would you handle this, or how have you handled this problem? So you'll hear a little pause while we're waiting for you to type in your thoughts. Then the panelists will kind of, we'll look at what you've talked about, and the panelists will have an opportunity to respond and share their expertise as well. So we'll do that. We'll move through a couple of scenarios, and we'll see what kind of great strategies and suggestions we come up with. Alrighty, so here we go. Oh, here we go. Before we're going to jump into our scenarios, we did want to take a second, so I'll turn this over to Cynthia to get a sense from you about what your biggest challenges are, and then we'll dive into what we've prepared. Go ahead, Cynthia.
Okay, so for this, we want feedback from you to hear what some of your big challenges are when you work with children in child care settings. And to respond to this, I want you to look over to the left side of the screen to your text tool. That's where the you see the letter A, and you click that letter and the box that with the A and the lines, and then click on the screen and you can type in your response. You might have difficulties, challenges in any of the areas of coaching that are listed at the top of the screen in green letters, like joint planning or observation, action practice, reflection, and feedback. And I see some people typing now. Yes, unlike in a home environment, there is turnover at child care centers, and in some child care centers, the teachers change frequently, so you might not get that continuity with one care provider there. I see a couple of people are commenting on that, the turnover among the teachers. And probably the biggest one that we hear about is that in these settings, the child care provider just doesn't seem to have the time to be able to interact with the person who's going in to provide services. And we see again, if you look at the top of the screen on the right, that the child care providers just are not able to give their full attention to the coach because they're working with the kids, or maybe because they need to maintain the ratios in their class, so there's not an opportunity for them to stop what they're doing with the children and work with the provider. Right, I like this one a lot, that the child care provider or the teacher might not be comfortable with another adult in the classroom. And this can happen for a number of different reasons. People might not be comfortable because they feel like you're coming into their zone to tell them what they should be doing, or they might worry that you're going to notice something that they're not doing well. Or it might just be really busy and they don't really want another person in the room because it interrupts the flow in their routine. The number of children in the room and the number of teachers is one of the main differences between a child care setting and a home. And with this kind of challenge, we've got lots of children and few teachers, which means that the teachers probably need to be at the ready to respond to the needs of the children. And that's difficult when they're also trying to interact with the service provider. And I like this comment at the bottom of the screen now that says that there can be a vast difference between the family's concerns and the child care provider's concerns. So I've seen this several times where the family is concerned about the way a child uses language in the home, but at the child care setting, the teachers just aren't really concerned about that. They may be more concerned about different issues, for example, behavioral issues.
Yeah, and I really like, Cynthia, the question on screen. How do you focus your attention on just one child? I think that question, we could think about that as the early intervention service provider. It's kind of hard when you've got 4 other toddlers climbing on you, but it's also certainly a challenge for the child care provider whose job is to focus and keep an eye and manage the whole classroom as well.
That's right.
So lots of good challenges. I don't know that these are good challenges, but they're very real challenges. And I think we'll see overlap with the challenges we're going to talk about today, certainly.
Definitely. These are very much like the challenges that we heard in our last session together.
Okay, well, why don't we keep moving along and we will jump into challenge number 1. So challenge number 1, Miss Felicia, the lead teacher in the room, is always very busy. When you ask if you can speak with her, she tells you to go ahead, but she keeps working and seems uninterested. You know that if you don't have her buy-in, early intervention isn't likely to be successful. What do you do? So this challenge, I think, is reflected in some of the comments we made in the last slide. Busy teacher, she doesn't seem really interested, or maybe she's just really busy, but you've got to figure out a way to get her buy-in so that she's able to use intervention between visits. So go ahead and take a minute, type into chat some ideas. How have you worked with a teacher in a classroom where the teacher's really busy and doesn't seem terribly interested? What would you do? I'm going to pause to give you a chance to think and to type. All right, I see lots of folks are typing, which is fantastic, so keep at it. I see we've got a comment here from Fairfax. Ask if there's a better time of day to communicate with her. So that's a great place to start. Maybe you've picked the craziest time of day and it's just not going to work for her, so let's check in with the teacher. Absolutely. Heather says, we'll find out what information would interest her. If you can address a particular difficulty in her classroom, so if you can help her, you're definitely going to get more buy-in. Great idea. Norfolk says schedule the visit at a different time or during a different routine. I love Goochland Powhatan. Compliment her. Ask for her insights on the child. Yet rather than going right in and thinking we've got to get to work fixing something, take the time to build rapport with her. That makes a big difference. Yep, ITC Highlands, focus on what you can do to help the teacher. Any specific challenges you need. Oh, I love this one. I wish I knew who put it through. Ask her to talk about the child's strengths and personality first. So before you go to the challenges, let's go a strengths-based approach. Yep, Danville, Pennsylvania suggests a phone call, maybe to explain coaching practices, include the family. So just maybe, that's a great idea. Before you even walk in, could be that Miss Felicia doesn't even really know what to expect. She might be expecting you're just going to sit down and work with the child and she doesn't need to be involved. Yep, Harrisonburg Rockingham says maybe ask what's the most challenging part of the day, and ask if there's something you can do to help with that. So kind of get into that. How can you help her? Yep, we got great questions here. What her biggest priority is. If it's okay to help give out a snack or go outside. Yeah, Bonnie, that makes a great point. Help the teacher. Just sit in there. I can think of many times where I helped wash hands or helped line kids up to get them to go outside, put jackets on. The teacher sees you as an ally. That's a great way to build rapport. So Corey likes, Miss Felicia, you are lovely. Compliment that teacher. We do want to take that time to build rapport. You guys have come up with fantastic suggestions. Feel free to keep typing them in. I'm going to turn to our panelists. And let's see, why don't we start with you, Patty? Is there any strategy that you've used to kind of get that buy-in from a teacher?
I think there's some great suggestions, Dana. They're definitely seeing, excuse me, the best time that the teacher's able to chat. I sometimes think that the teachers think that we're there only to focus on the child, and getting information from them is sometimes the most important information you can get, especially in your first few visits. So maybe recommending, is nap time a good time to chat? Even if you're really not going to be able to observe the child, getting some good information, because you're also developing a rapport with that teacher, and you really want her to know that you're working with her and not just coming in and telling her what to do. So I think that would be my biggest suggestion, and a lot of people seem to hit on that. Lunchtime also tends to be a little hectic, but it also sometimes isn't as crazy because the kids are focused on their food, so the teachers are able to chat a little bit more while the kids are still awake.
Yeah, I love that idea, Patty, and even what you said about nap time or chatting time. I think it's almost like we have to give ourselves permission to take the time to get to know the teacher. We might not need to walk right in the door and start fixing things or start working directly with the child, but we're a guest in their environment just like we're a guest in family's home. So taking that time to get to know her, Ms. Felicia, would make a lot of sense, and I think would make your job easier in the long run. Absolutely. Let's touch base with Andy. Did you have any other suggestions, Andy, than what we've seen so far?
Oh yes, I agree totally with Patty. It's the biggest thing for me when I enter a child care center is I have to almost earn the teacher's respect. They think often that we're just there to pull the child out of the classroom, and it's one less child they have to worry about while we're there for that hour. And so it's a lot of education and team building, helping them out when you can, help pass out snacks, help put coats on to go out on the playground. I think the best thing I can do is rearrange my schedule to match their schedule once I get their routine down. And I always try to end or begin my session at a slow period that's slow for the teacher, meaning like I'm there for morning circle time and centers, and then they go outside. And once we're outside, that's where I'm ending my session, and I'm doing a lot of my coaching and talking to the teacher. Snack time's another good time. Lunch time's a good time unless the teacher goes to have her lunch at the same time. So once you know their schedule and you've earned them, I found it to be to go a lot more smoothly.
Yeah, I love the way you say that, Andy, that you're earning the teacher's respect and earning her time. I think that's a really great way for us to approach that partnership, that it's an equal partnership and we want to collaborate with them. I also like your idea of kind of thinking about how your visit is going to fit into the day and where you can, see what you need to see, work on what you need to work on, but also have that teacher's attention. So you sort of spread out your visit across a couple of routines. We do have a question in here about billing, and I don't know if that's a question that you or Cynthia or Patty can answer kind of quickly, but folks are wondering if you're not observing a child because they're napping, is it considered a billable? Is it a billable and considered a session? I don't know, Andy, if you can tackle that one, or we can ask Cynthia.
Okay, I will. To me, they can be asleep for part of the time. I do feel that it's really hard to coach a teacher for an entire hour if that's how long they're asleep. So, if they go down for a nap while you're there and that's the amount of time you're using for coaching, I consider it billable because you're still working with the teacher in order to work with the child when you're not there. Does that make sense?
Yeah, I agree. It does make sense, and I teach ignore
been napping and you spend your whole the child is never awake. I wouldn't bill for a full hour. I might do a 15-minute unit of coaching with the teacher and then reschedule the rest.
Okay. It looks like Norfolk has said the same thing. Per the practice manual, if the child falls asleep during the session, you can still bill for it. And I love it that folks are supporting each other in the chat. Thank you, Andy. That's great. I'm going to touch base with Cynthia, see if you had anything to share, Cynthia, before we move on to Challenge 2.
Well, this is an interesting challenge, and it's really common. And there are a couple of different ways that come to mind to address it. And the first one would be before you go to the room for the first time to meet with Ms. Felicia, or the lead teacher. Hopefully she knows that this is how coaching works, is that you're going to be having a conversation with her and also interacting with the child. So if you can do something up front so that she knows what to expect, then that usually helps. I was in one child care setting where when we told the director that this was the approach we would be using, she quickly brought in an assistant teacher to the room so that the lead teacher could have some time to be freed up to work with me. And it wasn't the entire hour, but it was a large chunk of that time. And then some other strategies that come to mind are just kind of hanging back and observing, because I think you get a lot of good information that way, and that might help her want to start the conversation with you so that you're not kind of going back to her to always start the conversation with her. Yeah, those are the two big ones that come to mind for me. Oh, and asking questions like, do you see him having any difficulties in the room, or is there anything that you could use help with in working with this particular child?
Yeah, I think another great question, Cynthia, would be, it'd be great we could learn some of this through observation, but to ask her, what are his favorite things to do? What's he really enjoy? What's the best part of the day with him? Some of those questions we ask parents too. It would be interesting to see if some of that information that should be on the IFSP already carries over in the child care setting, in terms of what he likes, what his daily activities are like, and where it's different. So I think that you make a great point of asking, kind of gathering information that helps get the buy-in, because it helps the teacher know that we're interested in her, what she knows and her expertise too.
Right, and I think that's especially helpful when the teacher's concerns don't match the parent's concerns in the home. So if you come in thinking that that you're working on language, and that's what the lead teacher thinks that you're working on, but her concerns are different from that, then you might not ever get her buy-in until you hear what she's worried about or how she thinks that the child is doing in the room.
Absolutely, absolutely. All right, let's go ahead and move on to challenge number 2. And Andy actually kind of mentioned this one when she was talking, so it was a nice segue. This challenge will look familiar to you guys, I guarantee it. So challenge number 2. The child care provider suggests that you pull Mason out of the classroom to work with him in an empty room next door. She doesn't want the other children to be a distraction. So what would you do if you've been in this situation where the child care provider suggests you work somewhere else with the child? How do you handle that? Because that's one where you're often caught right in the moment when you walk in the classroom. So there's lots to consider. You can think about why the child care provider might be suggesting that. What could you have done or do in that moment or ahead of time? So type into chat, how would you handle this situation? I see some folks are already starting, which is great. Another thing you can think about is how could a service coordinator help here? So I'm going to pause and give you guys a chance to type, and we'll see what you put in. Great, they're coming in. I love it. There's lots of typing going on. So Kathy gives a great suggestion. I usually say let the teacher know that she'd like the other children to be a part of what we're doing. Absolutely, because those other children are going to be there when you're gone. So we need to figure out how to do that. It also supports the inclusion of the child you're working with. And make sure the teacher knows that to continue with their normal routine. Yep, and that's really important. Go ahead, you're there to join them as opposed to interrupt or change their routine. Yep. So Danville Titsley needs to explain the benefits of natural environment and help them, I think would help the child care provider know what that means with the services in the classroom. When you get to see that when you're a part of that classroom, just like you guys are saying, we can see what the challenges may present for the teacher and the child together, because you're right, their interaction is so important. Let's see, Kristen says, often it's helpful to see how the child interacts with the peers as well as the teacher. So I tell them I'm there to see what struggles they have in their normal routine. So you're right, that peer interaction is really important to see too. I love ITC Norfolk politely explain that EI is provided in the natural environment to help the provider find strategies to use in everyday routines. So some of the language we use with families we can certainly adapt and use with the child care provider as well. So they say we're going to tag along to whatever the teacher's already doing, so kind of reiterating that we're here to support the teacher. Explain the reason that I want to be Harrisonburg Rockham, I want to see authentic interactions. We want to see the child interacting with other children. And like Highland said, yep, great language opportunities with the other children in the classroom, so you want to be present to actually see that. So Bonnie says, yeah, I think there's a great opportunity here. This teacher, to me, Mason's teacher, feels to me like she maybe doesn't understand what to expect. She doesn't want the other children to be over distraction, so she's probably doing what she thinks is best. So we're going to explain how other children are a part of the interaction, and we're going to explain coaching. Andrea makes a great point. Ask the teacher why she feels like you would need to leave the room, and then you get the chance to share some information about EI. Yep, so you guys, I see lots of pattern there. It's a great opportunity to explain to the teacher how early intervention should work, and then go from there. I'm looking, Tara just typed one more in. So yeah, I love it how you said ask the teacher if it's okay if the other children play too. So asking that teacher for permission is a great idea. So you would tell her, I'm here to help you. So teachers usually find this helpful once they get used to me being in the room. That's a great point, Tara. I'm going to turn over to Andy, because I know, Andy, you have a suggestion for how to manage that comfort level to getting the teacher used to you being in the room. Would you share that?
Sure. I have found it incredibly helpful, and it happened by accident, where I had one child I would go see for an hour on the IFSP in the child care setting once a week, and then at the same time I was doing it at a different child care center, and that child was twice a month for an hour in a different child care setting. And I found that the teachers and the other children in the classroom got used to me being there quite more quickly when I was there every week. And then I wasn't a huge distraction when I came or left the room. I was just part of the routine that would happen on that day of the week for that hour. So from here on, I have started, if I know ahead of time some of the sessions or all the sessions are going to be in a child care center, I ask on IFSP for my visits to be front-loaded so that I can go in weekly for an hour, say for 1 or 2 months, and then decrease down to 2 times a month from there in. And I know we're also looking at changing IFSP to just put a number of visits and number of in a month's time, or in the next 3 months, or however we're going to do it, or for the next 6 months. I know we're looking towards changing towards all that in the future, but for right now I have been asking to front load and go in weekly. And the kids actually have gotten so they don't even notice when I come in. It's not like, oh, she's here, and they all stop what they're doing and it disrupts the classroom. And the teachers, I was able to earn them over much more quickly And then the other thing that I have found to be helpful is, especially if the Child Care Center was not part of the writing of the ISSP when it was written, I have been bringing in a photocopy of just the goals from the ISSP to share with the teacher for them to put in their child's binder and have it so they know what we're working towards. So sometimes just having it in writing and they have a visual thing they can reference back to has helped. And if none of those goals are really addressing the teacher's concerns, that might mean, we need to pull service coordinator and parents in and meet with the teacher and have an ISSP review. But those are the two things that have really helped me with this challenge, where my providers always think I'm just going to come in and take them out of the room.
Okay, thank you, Andy. Yeah, I love the idea of touching base on the outcomes, because there's lots of opportunities to pull that provider in here. I always think with this kind of a scenario, most likely the provider is doing what she thinks is appropriate, so we have to do that education piece and build that rapport time. So thank you for those suggestions. Let me check in with Cynthia. Did you have anything to add, Cynthia? Have you been in this situation?
Well, sometimes as I was listening to Andy, her suggestions are also some of the same ones that I would offer. But I wonder if the teacher's worried about the other children being a distraction. I've often worked during outside playtime so that the child naturally is interacting with the other children and you wouldn't really want to take him to another room during that time, and the teacher's sort of freed up to be able to talk to you more. Or you could very nicely explain or comment on how the child is interacting with his peers and have that be the focus to let the teacher know that how the child works in the classroom and with the other children is really part of the goal for him to be successful in that environment.
Absolutely, and that's going to tie in nicely to our next challenge. Let me check in and see if Patty had anything to ask, and then we're going to move into another challenge that focuses right on that behavior in the classroom. Patty, did you have anything else to add?
No, I think Andy and Cynthia really hit on most of the things that I had jotted down to add as well. I'm a big just jump right into the classroom and kind of integrate into what's going on. But I think it is really important to explain to the preschool teacher or the child care provider why we're there and why it's important that we stay in the classroom. And Andy and Cynthia, as well as a lot of people in the chat, hit on a lot of those great points.
Okay, great. Thanks, Patty. So let's move on to challenge 3. And now challenge 3 gets a little more complicated, you'll see. So challenge number 3. You've been visiting Alexa in her child care classroom for 3 weeks now, and each time you come, the room is in chaos. Toddlers are wandering around the room, several are always crying, including Alexa, and there are minimal toys available. One of Alexa's outcomes involves her behavior, as her parents were told she keeps biting other children. You know that more structure is needed, but what do you do? This one I can definitely place myself in this challenge from when I was working in early intervention, walking into the toddler classroom and really having to be mindful of leaving my judgment at the door and figuring out how to handle that situation. So we've kind of got multiple components here, kind of a room in chaos, our concern that no more structure is needed, but we also have Alexa's biting behavior. So let's kind of focus on the big picture and think about what would you as a service provider do in this situation. So good, I see folks are starting to type, so I'm going to pause to give you a chance to think a little bit. And thank you, Andy is typing in kind of a synopsis of some of the strategies we've come up with each challenge, so you'll see that here too. Okay, so we have some suggestions starting to come in. ITC of Norfolk says ask the teacher about her day, what her priorities and concerns are. So you're right, that's a great way to approach this because chances are that teacher knows that room is in chaos as well. So she might have a take on why that situation is there, and we certainly would want to approach that to collaborate with her and find out what she thinks before we offer any suggestions, any strategies, or really any observations. If we can kind of find out what she's feeling, that we're always going to, it's always a good, more positive place to start. So Kathy says she might ask the teacher if she has any concerns. She might usually just comment, you can see you have your hands full, and open up the opportunity for suggestions and just let the teacher know that you're available there for suggestions. I think that this is you'd have to be it's a delicate place to be, because if we walked in and said, I've got some suggestions for this crazy room, I don't think you're going to have a whole lot of buy-in there. So you're right, we're going to have to be careful about how we open up that door. So Corey asks a specific question. What do you think might most help Alexa? So kind of keep the focus on why you're there to support Alexa. Kathy says they've used social story strips. Yep, that's a very specific idea. Initially try to get a sense of the philosophy and routines of the classroom. So maybe before we jump in on the chaos, just sort of step back and do some observation. Harrisonburg, talking with the provider about the most challenging part of the day. Brainstorm why the provider feels it's difficult. Maybe have a dialogue and not a lecture. A great, great point. All right, so let's see what some of our panelists would have to say. I think I'm going to start with you, Patty. Do you have a suggestion in this situation?
I think, when we were talking about this last week during the practice session, it really, to me, is really important that we know what the teacher's priorities are. We all define chaos differently. So it would really be, what you're seeing and seeing as chaotic might be totally what she thinks is completely normal for her. I would really want to touch on what she is most concerned about with Alexa. I've had the experience where we go through this whole IFSP process, we write the IFSP, and we focus on the parent's priorities, but oftentimes, as I think we pointed out in another scenario, the priorities of the child care provider might be very different. And it could be, how she's viewing Alexa's behavior in the classroom versus what her parents see her behavior being as a struggle in that classroom. The biting is certainly an issue, but the child care provider might have a different view on that. So I think that would be an important part. And as we mentioned in the other scenario, you've got to find time to be able to talk to the child care provider. And this scenario makes it sound like in this particular time, it's not a great time to talk to her. So trying to figure out when you could be able to do that.
That's a great point, Patty. So you're right. It could be chaos because of this particular time of day. There's lots of different aspects to this. So we would need to find out what the teacher thinks about this. Andrea makes an interesting point. She says sometimes if your gut feeling is that it's not a good fit for the child, it could be worth having a discussion with the family as well about what you're seeing. And I have had to have that discussion too. So I think sometimes unless it's something like a reportable issue, if it's something you're seeing, give it a little time. If you see it across time and you're still struggling with the environment, absolutely the family is part of the team. We're going to bring them in. Danville says, it's not our place to judge the classroom environment. However, having a conversation with the teacher, the biting outcome within the classroom is a great idea. So we want to go back to that IFSP and bring in while we're there. Maybe discuss ABCs of behavior, think about the time of day that that biting is occurring. So I like it how you're kind of bringing it back to that issue too. So this one's kind of complicated. Cynthia, did you have any other suggestions to add?
I think just following on what some other people have already said, that being able to talk to the teacher and find out what her concerns are. She may feel like the biting is the biggest problem, and she may not. She may feel like she needs more help in the classroom, and having a conversation with her, you may be able to help her deal with other issues that are completely unrelated to what you came for that day. I've seen teachers completely overwhelmed and say, like, I really need someone else in the room at this time of day. And you can support that teacher in that way. But just having that dialogue is what's going to help you know what the teacher's concerns are and what she really needs help with right then.
Yeah, I think that dialogue too would help you kind of tease out what's contributing to the biting. Is it the chaos in the room? Is it the fact that Alexa doesn't have a way to communicate when she's frustrated? Is it, there's a clash with some of the other kids? There could be so many different reasons. It could be more of a, social, emotional kind of thing. I mean, there's all kinds of reasons for, if we looked at the biting, we kind of assume that the chaos and the biting are probably related. We think there's more structure, but we'd want to really talk with that teacher and do some good observation before we jumped in with any suggestions. Yep. All right, let's tackle, in the interest of our time, I'm going to go ahead and let us tackle challenge number 4. So challenge number 4. Devin has multiple disabilities and attends his church preschool 3 mornings a week so that he can be with other children. Each time you visit Devin there, you find that he's not included in the activities. Instead, he spends most of his time sitting in a stroller or being carried around. When you ask the teacher about this, she says that since he can't sit or walk yet, she doesn't want the other children to step on him. So what would you do? You know, I think Devin's teacher looks like she's kind of got Devin's safety in mind. So again, you know, there's some good reasons why she's trying to do what she's doing, but he's really not included in the activities, which is a part of the purpose of him being there. So go ahead and type into chat what you all would do in this kind of a situation. How would you support the teacher, and how would you support, you know, sort of the transition to having Devin the active, included part of the day? And we included this challenge because I've heard folks say, you know, when we're thinking about working in child care settings and working with coaching, supporting a child who has multiple disabilities sometimes can seem more complicated. So I wanted to give you the opportunity to address that. And boy, the little chat boxes are just lighting up. I can see lots of folks typing. So I'm going to pause and let you get your thoughts into chat. Okay, so we see might be a good opportunity to explore what the teacher and the parents know about assistive technology options. Yep, maybe for positioning to support Devin, find out what they're already doing, and it sounds like the stroller and carrying him is what they're doing. So what could we do to help him be a little more independent? Norfolk says, ask the teacher how she feels about Devin's participation in the activities. So that's a great idea. Before we make any comments, what does she see? Start asking about what other places he can be positioned to participate. So start that brainstorming with the teacher. Find out what she's doing, ask to observe, and go from there. Yep, and Heather says the next step, problem solve a safe way for him to be able to sit with his classroom. You know, it'd be a great idea to find out what they already have in the classroom that could support this. Tara says brainstorm with the teacher what she would need to feel more comfortable allowing Devin on the floor. So maybe some adaptive seating. Yeah, so we're not only focusing on Devin being included and in some kind of seating, but let's talk about what this teacher needs and what would make her feel more comfortable. Talk about her concern for his safety and brainstorm ways to help him participate. I'm trying to read it. Yep. And sometimes model ways to include Devin, model ways for positioning. Absolutely. I love this. Danville writes, acknowledge and praise the teacher's efforts. So start there. Start at the positive and then talk about possible ways to support him and maybe what supports the center may need. That's a great question. I'm going to throw this one to Andy and see if you have a suggestion, Andy. So I'm sure you've done this before as an OT.
Oh, yes, sure. And unfortunately, it does take some time to get equipment together to get the child positioned to be more involved. So I often, in the beginning, try to come up with some other ideas to keep the child involved. And one of them is, could a floater teacher come in? There's often a floater teacher that's designated to float between classrooms so that teachers can go out and use the bathroom or have a lunch break. Could that floater teacher come in just for that one particular activity that you know the child, Devin, would really like to participate in? And the other one is there a way the teacher could, if they have an assistant teacher in themselves, just position them temporarily in their arms or on the floor in their lap to participate for part of the activity, and then if they couldn't participate the entire time and they have to go back to the stroller or a safe mat area where they're able to play with some other toys, could one of the peers go with them so that he has some social interaction? So kind of make it a 2-room activity instead of a 1-room activity, because 1 or 2 peers go with him back over and play in that area wherever he is. But it's all about earning the teacher again. And that floater teacher, we really didn't mention it before, but that would help in many of the situations we've already talked about.
Yeah, and I really like your idea, Andy, about getting peers involved. That seems like what a great way to, it sort of naturalizes what's happening in the classroom, and the kids are probably already hanging out with Devin, you know, and helps him be a part of that social interaction as well. Let's check in and see, Patty, what have you done in this kind of situation?
And I'm going to kind of mirror what Andy said. I love the use of having a peer that can kind of look out for Devin and kind of be the one that kind of, I wouldn't say helps out with the safety, but kind of also helps be a peer model for him. And just to kind of ease the teacher's concerns about safety a little bit. Maybe one of the children's a little bit older, and that preschooler has abilities that are a little bit higher than where Devin is. She hit on a lot of things that I was jotting down as she was talking, so it's kind of hard to come up with anything else because this is a challenging situation. But as she wrapped it up, and that rapport with the preschooler or the child care teacher is so, so very important in almost all of these scenarios. And if you don't have that, you're really not going to be able to work with them as a partner as we should be when we're going in all these different environments.
Yeah, and speaking of partners, Patty, I was thinking this might be a good situation to bring the service coordinator in because if there is a need for assistive technology or positioning devices or whatever, the service coordinator could be a great resource too. I mean, certainly you'd bring the family in too, but this could be a good time to touch base, maybe with an IFSP review or at the minimum, at least a phone call to get that discussion going because maybe there's more early intervention can do to support Devin in that environment. I mean, always if there's a way to use what's already in the environment, that's the way to go. But if there's additional kind of technology or positioning needs, the service coordinator could really help out there too. Okay, Cynthia, did you have anything to add here? Any other thoughts or ideas?
No, I think that Andy and Patty really covered it. One thing that came up during our practice session that seems like it would always be worth exploring in these kinds of situations is whether the teachers have seen him in different activities more able to participate because the location is different or maybe because he's in a chair at a different time or some other way that you could think you could help them reflect on ways that he might be more successful and able to participate and then help direct them back towards that again. But I think this all comes, as Patty and Andy both said, from having rapport and an open dialogue with those teachers.
Absolutely. I love it how you said, kind of find out where is he already successful. If there's something already working, then maybe we can spread that over other routines and make that work. So absolutely. All righty. Well, we're going to get ready to wrap ourselves up today and be open to any questions you all had. What we hope is that our discussion today has given you some food for thought. Wouldn't it be nice if every visit to a child care center looked like the picture we had on screen, where we have a happy child care provider, a happy parent, and we're in there able to provide great support. We do appreciate that child care settings are really unique, and because the way we individualize intervention, there's probably always going to be some kind of challenge, some way that you have to use your skills a little differently. And we do respect and understand that you kind of have to do the best you can, but we always have to remember to go back to using our best practices, go back to considering ourselves as a coach and consultant to that child care provider and thinking about how we can make the best use of our time. And we know that might not mean you get to coach that child care provider the entire visit, but with some creative thinking, some flexibility, and lots of good communication and rapport building, I'm sure there are lots of as many challenges as we can come up with. There are also examples of great success too. So if we didn't get to your favorite challenge today, and I'm sure there are lots of them out there, we want to invite you to submit your challenge, and we can try to tackle that. You're welcome to submit it to me. You can see my email address on screen, or you can submit it through, there's a Help Us Build the Blog, I think, item on the Early Intervention Strategies for Success blog, and you can submit an item there. It's probably easiest just to email it to me. But if you have a challenge you would like to have some ideas on, I would love to have them, and then we will prepare a blog post and tackle those challenges. I'll probably tap into lots of the expertise of our panelists today, and we'll come up with some great strategies. So feel free to share that way. So we have a few more minutes. We wanted to just take the last couple of minutes in case there are specific questions you wanted to ask the panelists. Oh, thank you, Jeannie. She put the blog link here in the chat. If there are any particular questions you wanted to type in and have either the folks on the phone with us, your fellow participants, or the panelists tackle, feel free to do that. So I'm going to pause for a minute and see if folks have any questions. Okay, well we will keep the line open and the webinar live for a few more minutes in case something pops into your head that you'd like to ask. In the meantime, I'll go ahead and show you our names and our email addresses so you have access to those too. And so if you want to follow up with me, certainly with Cynthia, Andy, or Patty, feel free to do that, and we would be happy to follow up and support you after the webinar. I also wanted to let you know on the blog we have a post on our What Would You Do series that really hones in on our second challenge today about the teacher wants you to pull Mason out of the classroom. What do you do? So I encourage you to look that up on the blog. There's some strategies there, and you could feel free to add your suggestions there as well. And I think, trying to think if there are there any other resources our panelists would like to share, any others that I've missed? Okay, well, I want to thank you all for joining us. I want to let you know that our next talks on Tuesday in May will be about working with families who have children with challenging behaviors. So you certainly, if you join that, I bet you'd have some strategies you could use in the child care setting as well. So I encourage you to join that webinar. After today's webinar, you will get an email with a link to a survey. If you complete the survey, then you'll have access to your certificate of completion. If you are in one room with multiple people in the room, if you're watching this webinar with your peers, feel free to forward that email to them so that they can complete the survey and have access to a certificate as well. I want to thank our panelists. Thank you so much, ladies, for joining us. And thank you, Cynthia, for round 2 on the webinar. I really appreciate you all sharing your expertise and being available to support people after the webinar. I don't see any questions, so I think I'm going to go ahead and wrap us up for today. Thank you so much, ladies, and thanks everybody who joined us today. I hope you have a wonderful rest of your day.
Thank you, Dana. It was great to be here.
All righty. Thanks, everybody. See you next